This is KTVO's Good Morning Heartland.
And welcome back. As you know, February is American Heart Month, but do you know the symptoms to look out for when it comes to preventing a massive and potentially deadly heart event? Well, to learn more about that and what you can do to keep your heart in check, we have Dr. Mark Shima, a cardiologist, here this morning to break it all down for us. Good morning. How are you doing?
Doing fine.
Well, first of all, let's go ahead and start off with what happens to our body and our heart in the event of a heart attack.
Well, a heart attack to a doctor means that heart muscle is going to die. And in the majority of cases, that means that a clot has formed inside one of the blood vessels feeding the heart muscle. Now, the clot usually forms on a cholesterol plaque, so that's why both of those things are important. And the clot is so important that taking aspirin is usually the first thing that's recommended when you feel those symptoms coming on.
Now, sometimes we hear, oh, somebody's having a heart attack, somebody's having cardiac arrest. Are those two similar? Are they different? Can you explain that?
A heart attack may cause a cardiac arrest because of not enough blood flow and oxygen to the heart muscle. The heart goes into a totally chaotic rhythm which can't pump any blood to the brain, and so you collapse. But a heart attack is not a cardiac arrest. They're not always associated.
Okay. And now let's go ahead and talk about the symptoms. What should we look out for?
Well, probably everyone thinks the most common symptom is the severe chest pain and being behind the breastbone or on the left side of the chest. But really, any discomfort, pressure, tightness, squeezing, anything out of the ordinary across the chest, going into the armpits, down either arm, up to the neck, into the jaw, or even into the lower ears.
Interesting. Now, when it comes to men and women and a possible heart attack, is one group more at risk than the other?
No, actually, the men and women are about equal if you take all of the ages together.
Okay.
And the symptoms, of course, can be quite different, but the risk of a blockage is about the same.
Okay. Now let's go ahead and talk about some myths. A lot of people say, oh, I don't have, pain in my chest, I'm not having a heart attack, but they might have discomfort somewhere else. Are they having a heart attack? Explain that.
Well, I think that if you know you're a person who is overweight, who is perhaps a tobacco user, who has high blood pressure or diabetes, whose family history is positive for heart disease, especially at a young age, or who has high cholesterol that your doctor has said needs to be treated, in the back of your mind, if you develop a symptom that's out of the ordinary, you have to at least be suspicious of it. And it may vary very widely, especially for women. Women's symptoms can be totally different than men's.
Okay. Now, for those, if somebody is having a heart attack in your family or you yourself, and somebody wants to call 911 and the person having a heart attack saying, no, it's okay, the hospital's right around the corner. Do you recommend that, or do you recommend somebody calling 911?
Absolutely not. And I think what people need to realize is that 911 is not like the old days where it just brought a car with two people to put you in the car. The treatment for your heart attack starts in the ambulance. Electronic monitoring, even transmission of the cardiogram to the hospital. The ambulance, especially locally like ACAD, can actually transmit an electrocardiogram and we can start the process. That's why many of our patients with heart attacks, I will meet them at the door of the emergency room and we start their treatment and talking to them right there.
Wow, and that could be a life-saving move right
absolutely.
there.
Every second that we cut off of our time means we're saving heart muscle.
Wow, interesting. Now, for those that might say, oh, my heart's feeling okay, I need to stop taking these medicines, they're no use for me.
Yeah, the worst thing is that people will be started on medicine by their doctor for high blood pressure, diabetes, or heart failure, and they start to feel better. And they begin to feel, well, I'm better now. I don't need these medicines anymore. And sometimes it's the medicines that are keeping you feeling better. If you stop those medicines, you may backslide, and then it may be very difficult to bring you back up to that level of health again, especially with heart failure.
And what about, I know another myth that I hear all the time, including from my father, is I've smoked for 40 years, I'm not going to stop now, it's not going to do me any good.
That's right.
What do you have to say about that?
That's absolutely not true, because you have to remember there's two risks to the smoking. Number one, yes, is the longer you've smoked, the more likely that you could have a cancer of the lung, a cancer of the throat, or cholesterol blockages. But the risk of actually having a heart attack, having a stroke right in that second, is most closely related to your current everyday consumption. So when you tell someone every cigarette you don't put in your mouth and smoke decreases your risk, whether you're 60 or 80, it has a profound effect on whether or not you're going to be the one that suffers that stroke.
Interesting. Now, are there any ways or anything that we could do to, if we've never had a heart attack, to prevent it, or for somebody that has had a heart attack, can they prevent future heart attacks?
Well, we don't know if you can totally prevent heart attacks, but certainly we know things that you can do to decrease the risk.
Okay.
For example, stopping smoking, controlling your cholesterol, weight reduction back to a more ideal weight, exercise on a regular basis, and then making sure that you take the medicines that you're supposed to take to help your heart to be more efficient.
Okay. Well, thank you so much, Dr. Shima. What we'll do is we'll post everything on our website at heartlandconnection.com, and we'll also link up your information as well if they have any questions or concerns, okay? Thank you
Thanks,
so
Ella.
much, and we'll be right back.